Hello, Nemo.
Hello, Shrimp. Can I ask you a question?
Follow me. Even with this small head of mine, I know a lot of things.
Many of my classmates have cleft lip and palate. Do you know what those are?
Okay, okay. Hmm. Listen to my mustache. Cleft lip and palate are clefting congenital deformities of the baby's face during pregnancy that can occur together. A cleft is a non-fusion of facial structures, a fissure or a gap in the upper lip, palate, or both. It is called a unilateral cleft if only one side of the lip is affected, and bilateral cleft if both sides. Cleft lip or chyloschisis is the cleft on the upper lip. Cleft palate or palatoschisis is a cleft on the palate. Both could either be complete or incomplete. The causes are unknown. Many scientists believe that they could be influenced by genetic and environmental factors. The main problems of children with cleft is that they can't build up air pressure in their mouths because the air escapes out of the nose, and there is less tissue on the roof of the mouth for the tongue to touch. Velopharyngeal inadequacy is the inability to close off the nasal cavity from the mouth and results to hypernasality. The voice may also be hoarse because of the strain on the vocal cords in attempt to build up pressure. Tumors!
If you're talking about brain tumors, I'm the best fish that can explain to you about them because I'm round like a massive tumor. I'm pretty sure I can help you there, you little orange white fish. Nemo. Tumors in the brain can directly destroy brain cells. They can also damage cells by producing inflammation, placing pressure on the other parts of the brain, and increasing pressure within the skull. Causes are still unknown, but there are many factors that could affect its development, such as radiation, genetic influences, and exposure to certain chemicals. Brain tumors causes damages to certain areas in the brain that results to the slurring and or slowing of the speech, saying things that make very little sense despite efforts to communicate with the correct words, and sentences that may have words in incorrect order or even include words that have no relevance. My real mother had a fever when she was pregnant. I got a craniofacial anomaly.
Really?
That's why I have these scars, kid.
Wow, but you sound like you don't have any speech defects.
Ah, thanks to my SP. They really do wonderful work, kid. I could do things now. Craniofacial anomalies is a diverse group of deformities in the growth of the head and facial bones. These abnormalities are congenital and there are numerous variations. Some are mild and some are severe and require surgery. Cleft lip and palate fall under this category. Other types are craniosynostosis, wherein soft spots in an infant's skull close too early causing problems in brain and skull growth. Hemifacial microsomia, wherein tissues on one side of the face are underdeveloped, affecting the ear, mouth, and jaw areas. And deformational plagiocephaly, wherein repeated pressure causes a deformed shape of the head. This may be caused by problems during pregnancy and childbirth, genetic factors, and folic acid deficiency. Generally, they have delayed speech development due to their mouth's anatomy and problems in articulation.
Bloat! Do you have TBI?
Yep, I injured my brain many times.
Then consult an SP now! Traumatic brain injury is a complex injury with a broad spectrum of symptoms and disabilities. It is generally caused by physical trauma to the head, usually from damages by car accidents, car arms, and falls. They may be caused by open head injury, closed head injury, deceleration injury, or caused by continuous movement of the brain within the fixed skull, toxic chemicals, hypoxia or lack of oxygen, tumors, infections, or stroke. Persons with TBI usually lose their sense of smell, taste, sight, short-term memory, gross and fine motor skills, oral motor skills such as eating, blowing, or articulation of speech sounds, muscle tone in facial area, lips and tongue, or in certain cases, maintain muscle tone but lose ability to process speech or apraxia. They also have difficulties in swallowing or dysphagia, word association or aphasia, and emotional and behavioral control.
Parents never listen, right, kid?
Uh-huh.
but not my dad. You know, I wouldn't be surprised if you don't listen to what I say, because he's really hearing impaired.
Ooh.
Deafness refers to the complete loss of hearing ability in one or two ears. Hearing impairment refers to both complete and partial loss of the ability to hear. Conductive hearing impairment is a problem in the outer or middle ear and is often treatable. Sensory neural hearing impairment is a problem with the inner ear or with the hearing nerve, and it is usually permanent and requires rehabilitation, such as the use of a hearing aid. The causes may be genetic, problems during pregnancy and childbirth, infectious diseases, use of ototoxic drugs, and head or ear injuries. Not enough is learned by the hearing impaired child about the temporal characteristics of normal speech, so they have a vague idea of how words should really sound like. They have problems in timing and rhythm, wherein they talk slower with wrong stresses, longer pauses, and inadequate breath control during speech, in pitch intonation, usually in monotone, and frequent variations in pitch, in velar control, creating nasalization problems mainly because velar motion is not detectable by lip reading and it produces little proprioceptive feedback, in articulation, failure to develop and differentiate phonemes, and in the general voice quality.
That was come to Chatham got me in an accident. That's why I got cerebrovascular accident, aka stroke. I tell you, I had a lot of speech problems before.
Grabe!
The oscilloscum is really dangerous, so please don't try it at home. Cerebrovascular accidents or stroke is the sudden death of some brain cells due to lack of oxygen when the blood flow to the brain is impaired by blockage or rupture of an artery to the brain. This can be caused by genetic factors, head injuries, use of cocaine, atherosclerosis, diabetes, heart diseases, and high cholesterol. The damages can lead to weak facial muscles that cause drooling, problems in articulation, and in swallowing.